The enteric-coated tablet form of diclofenac, known as Xenaflamm Kit, is used to reduce pain, swelling, and joint stiffness from arthritis. This medication is a nonsteroidal anti-inflammatory drug, NSAID, that works by blocking your body's production of certain natural substances that cause inflammation. By doing so, it helps to decrease swelling, pain, or fever, ultimately allowing you to engage in more of your normal daily activities. It is important to consult your doctor about non-drug treatments and/or using other medications to treat your pain. The recommended dosage and optimal timing for taking Xenaflamm Kit should be discussed with your healthcare provider. Before taking Xenaflamm Kit, make sure to read the medication guide provided by your pharmacist. Take this medication by mouth as directed by your doctor, usually 2 to 4 times a day with a full glass of water, unless your doctor directs you otherwise. It's important not to lie down for at least 10 minutes after taking this medication. If you experience stomach upset, you may take it with food, milk, or an antacid, but keep in mind that this may slow absorption and delay pain relief. It's important to swallow the tablets whole and not to crush, chew, or break them, as doing so can increase stomach upset. The dosage of Xenaflamm Kit is based on your medical condition, response to treatment, and other medications you may be taking. To reduce your risk of stomach bleeding and other side effects, take this medication at the lowest effective dose for the shortest possible time. Do not increase your dose or take this drug more often or for longer than prescribed. It may take up to 2 weeks of taking this drug regularly until you get the full benefit, especially for conditions such as arthritis. Make sure to tell your doctor if your condition gets worse. If you experience upset stomach, nausea, heartburn, diarrhea, constipation, gas, headache, drowsiness, dizziness, or blurred vision, it's important to let your doctor or pharmacist know. This medication may also raise your blood pressure, so be sure to monitor it regularly and inform your doctor if it becomes high. In some cases, serious side effects such as changes in hearing, mental/mood changes, easy bleeding/bruising, or symptoms of heart failure may occur. It's important to seek medical attention if you experience any of these symptoms. Additionally, if you notice signs of kidney problems or liver damage, it's important to get medical help right away. While very rare, a serious allergic reaction to this drug is possible. If you experience symptoms such as fever, swollen lymph nodes, rash, itching/swelling, severe dizziness, or trouble breathing, seek medical help immediately. This is not a complete list of possible side effects, so if you notice any other effects, be sure to contact your doctor or pharmacist. If you have any concerns or questions about the medication, consult with your healthcare provider. The use of Xenaflamm Kit, which contains diclofenac, may rarely increase the risk of a heart attack or stroke. This risk is more likely if you take it for a long time, especially if you are an older adult, or if you have heart disease, smoke, have a family history of heart disease, or have conditions such as high blood pressure or diabetes. It is important not to take this drug right before or after heart bypass surgery. In addition, this drug may rarely cause serious bleeding from the stomach or intestines, which can occur without warning symptoms. Older adults may be at higher risk for this effect. If you notice stomach/abdominal pain that doesn't go away, black/tarry stools, vomit that looks like coffee grounds, chest/jaw/left arm pain, shortness of breath, unusual sweating, confusion, weakness on one side of the body, trouble speaking, or sudden vision changes, it is important to stop taking diclofenac and seek medical help right away. It's crucial to talk to your doctor or pharmacist about the benefits and risks of taking this drug, as well as the best time to take it and the appropriate daily dosage. Before taking Xenaflamm Kit, it's important to notify your doctor or pharmacist if you have any allergies to diclofenac, aspirin, or other NSAIDs. This medication may also contain inactive ingredients that could cause allergic reactions or other issues, so it's best to discuss this with your pharmacist for more details. You should also inform your doctor or pharmacist about your medical history, especially if you have asthma, blood disorders, nasal polyps, heart disease, high blood pressure, liver disease, stroke, or stomach/intestinal/esophagus problems. It's important to note that kidney problems can occur with the use of NSAID medications, including diclofenac. It's more likely to occur if you are dehydrated, have heart failure or kidney disease, are an older adult, or if you take certain medications. Be sure to drink plenty of fluids as directed by your doctor to prevent dehydration, and notify your doctor immediately if you experience any unusual changes in urine color or amount. Xenaflamm Kit may cause dizziness, drowsiness, or blurred vision, and alcohol or marijuana can worsen these effects. It is advised not to drive, use machinery, or do anything that requires alertness or clear vision until you can do so safely. Limit alcoholic beverages and consult your doctor if you are using marijuana. This medication may also increase the risk of stomach bleeding, especially when combined with daily use of alcohol and tobacco. It's important to limit alcohol consumption and stop smoking while using Xenaflamm Kit. Additionally, this medication may make you more sensitive to the sun, so it's best to limit your time outdoors and use sunscreen and protective clothing. Inform your doctor if you experience sunburn or skin blisters/redness. Before undergoing surgery, it's crucial to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. It's important to note that older adults may be at greater risk for stomach/intestinal bleeding, kidney problems, heart attack, and stroke while using this medication. For women of childbearing age, it is important to discuss the benefits and risks of using Xenaflamm Kit with your doctor. If you are pregnant or planning to become pregnant, notify your doctor, as this medication may harm an unborn baby and cause problems with normal labor and delivery. It is not recommended for use in pregnancy from 20 weeks until delivery. If your doctor determines that you need to use this medication between 20 and 30 weeks of pregnancy, you should use the lowest effective dose for the shortest possible time. It is also important to consult your doctor before breastfeeding while using this medication. It's important to be aware of potential drug interactions when taking Xenaflamm Kit. Some products that may interact with this drug include aliskiren, ACE inhibitors, angiotensin II receptor blockers, citalopram, corticosteroids, lithium, methotrexate, and water pills, diuretics. This medication may also increase the risk of bleeding when taken with other drugs that also may cause bleeding, such as antiplatelet drugs and blood thinners. Additionally, it's important to check all prescription and non-prescription medicine labels carefully, as many medications contain pain relievers/fever reducers that are similar to diclofenac and may increase the risk of side effects if taken together. If your doctor has directed you to take low-dose aspirin to prevent heart attack or stroke, it's important to continue taking it unless instructed otherwise. Be sure to ask your doctor or pharmacist for more details. If someone has taken too much of the Xenaflamm Kit and is showing severe symptoms like passing out or having trouble breathing, it's important to call 911 immediately. Otherwise, contact a poison control center right away. U.S. residents can call their local poison control center at 1-800-222-1222, while Canadian residents can call a provincial poison control center. Symptoms of overdose may include severe stomach pain, slow/shallow breathing, and extreme drowsiness. Always seek medical help if you suspect an overdose. Remember not to share this medication with others. Your doctor may perform lab or medical tests, such as a complete blood count, liver or kidney function tests, and blood pressure monitoring while you are using the Xenaflamm Kit. It's important to attend all medical and lab appointments and consult your doctor for more details. Making lifestyle changes, such as weight loss if needed and strengthening or conditioning exercises, may help improve your flexibility and joint function. Be sure to consult your doctor for specific instructions on how to incorporate these changes into your daily routine. If you forget to take a dose of Xenaflamm Kit, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take the next dose as usual. Don't take a double dose to make up for the missed one. Remember to take the medication at the same time each day for the best results. Make sure to store the Xenaflamm Kit at room temperature in a tightly closed container, away from light and moisture. It's important not to store it in the bathroom, and always keep it out of reach of children and pets. Remember not to flush any unused medications down the toilet or pour them into a drain unless specifically instructed to do so. When the product is expired or no longer needed, be sure to properly discard it. You can consult with your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.